I'm David Robinson. I work for Diabetes UK as the volunteer coordinator for the Eastern region, which means I cover Essex, Suffolk, Norfolk, Cambridgeshire, Hertfordshire and Bedfordshire. It's a massive area to cover, and I'm here today to support the NEEDS event.
Okay. And David, can you tell me a little bit about the Type 2 Together programmes?
Type 2 Together project started approximately 3 years ago in Essex, and we've grown it to 12 groups now across the Essex area, 7 of which are in the North East Essex area. The aim of the groups are to get people living with diabetes together to talk about how they can live better with the condition, and it's an open forum event where they can just sit around a table on average once a month with a facilitator who will guide the group meetings along.
Okay. And how's the feedback been from the patients who have engaged with the group?
Feedback from patients engaging with the groups is tremendous. In a number of cases, they report lower HbA1cs as a result of the information, but it helps their education and learning of living with the condition, particularly with type 2 diabetes.
And from what a lot of patients have said today about these types of groups and events like today, it's a lot about the sense of community and meeting other people with diabetes for their experience.
Absolutely, and that's what it's about. And we tend to find that when people are in a situation where they can openly talk with other people and learn from other people, they are much more likely to actually improve their condition, and learning more from other people is better for them, because the lack of response they get from the surgeries on occasions leads them to down a blind alley as to where to go for support. And I passionately believe that if we could increase the number of groups in North Essex, we could improve the care for people living with diabetes.
And what would you say to newly diagnosed people with diabetes in North East Essex who are perhaps thinking about attending a local support group but not really knowing what it involves?
I would say that it's a must. If you can attend a local group, go along, listen to what's said during the meeting. Everybody will learn differently, so there may be some people who might feel that the group support isn't for them because they don't want to talk openly about their scenario, but for a lot of people they will learn far more about living with diabetes in an hour session at one of those groups than they'll ever learn from the surgery or GP when referred and when first diagnosed, because the time element that the healthcare professionals can spare is limited, whereas the opportunities there for spending something like 12 monthly meetings of an hour plus a year is far better than the 15 minutes of care that you get in the surgery. Yeah, I mean, Diabetes UK is always looking to help people improve living with diabetes, so helping attend events where we're raising awareness in any way, shape or form. I'm happy to support, and quite often go out to events across East Anglia where we're doing that, and work quite closely with NEEDS, and particularly to support some of our groups. And as I say, I would really love to find more facilitators so we could increase the number of groups.